next presenter, we are very, very enthused about having with us. She has joined, or will be soon joining, our local neurology team here in Western New York, and we are excited to have her here. This is, in a sense, our chance to announce her presence, announce her availability, and I know that there was an extensive search that was put forth to find somebody of her caliber and her talents. And one of the great benefits, too, is that she's a local gal. She grew up in the area. She graduated from Canisius before moving on to Michigan State for her medical training. And she's been working in Rochester, and we are very fortunate to have brought her back to Buffalo. One of the greatest challenges I have found is her name. And being someone who has a history of having worked in radio, we take great pride in the fact that phonetically we can tackle anything. Give us a name, we'll figure it out, we'll make sure that we get it right on the air, and I have not yet gotten her name right. But so she has given me permission to call her Dr. Kelly, but I'm going to give it one more shot, and it's Dr. Kelly Andrezejewski.
Very good. Okay, I'd like to thank everyone and Pat and Chris for inviting me to talk today. I am a local, so it's great to be coming back to Western New York, and I look forward to hopefully meeting some of you in the next couple of months to years. So I was invited today to talk a little bit about deep brain stimulation. I'll be working with Pat and Dr. Plunkett, who are currently our leaders in the deep brain stimulation program here in Buffalo, at University of Buffalo. And I'll be the neurologist that will help be doing the programming for individuals after they've had this surgery. So to just tell you a little bit about deep brain stimulation and what it involves is essentially it starts with, we place 1 or 2 leads on each side of the brain. It may be done usually in a 2-stage operation. And then you come back for another operation where a wire is tunneled from the leads that the neurosurgeon places initially at the back of your head, and then it's tunneled down into your neck and then connected to a device called a IPG as a short way. Essentially, it's the impulse generator battery, much similar to a pacemaker battery. It's the same idea and about the same size, that's inserted right below your collarbone. And that gets connected to the wires that are tunneled up and go into your brain to provide the electricity, essentially, that helps people with Parkinson's as well as other tremor disorders. So what kind of symptoms does deep brain stimulation actually improve? It's primarily the symptoms that improve with one of our most common medications called levodopa or Sinemet. So the usually most beneficial symptoms that we see with levodopa as well as deep brain stimulation is improvement in slowness of movement. You can have improvement in stiffness, or also what doctors call rigidity, in addition to tremor. Those are some of the most prominent symptoms that we can see benefit for, especially after we turn someone's neurostimulator on. Another symptom that oftentimes people develop complications from taking levodopa and or with some of the other dopamine-like medications that we treat people with Parkinson's disease. These movements are involuntary movements we call dyskinesias. So there's also, with some of our special techniques for programming, we can actually help reduce dyskinesias, if not almost silence them. So this is just an example of what, I'm going to show you a video of what a patient with Parkinson's disease, mind you, every patient with Parkinson's disease has a different variation and is unique. Some people have more tremor with their Parkinson's and have significant tremor. Other people have little to no tremor, but they have significant stiffness and slowness. So as you all know and probably have met each other, some of you before, you're all a little different and unique and special. So this is a video we show provided by one of the deep brain stimulation hardware makers, Medtronic, showing a gentleman after he's taken his medications and some of the benefit that you can see with his medications. So you can see as after his arm has kind of been extended, he develops the typical resting tremor we see in Parkinson's disease. So I'll just let the video finish playing here. So the next part is he's going to stand up, and this is what we typically see, the shuffling with Parkinson's disease. Sometimes this is often commonly what can lead to people falling, and you can see his little small steps. Oftentimes once people get going, they walk much more fluidly until they come to something like going through a doorway that might slow them down. So the next thing I'm going to show you is a patient once after they've had, the same gentleman after he's had deep brain stimulation. So we can see he doesn't really have much tremor right now. Before we saw when he had his arms extended for a while, his tremor came back out. Oftentimes we call that reemergent tremor. So you can see he's moving pretty fluidly with turning his hands back and forth. And now he's going to get up and stand up and show us what he can do with his how much better he walks. Now, I think this kind of shows you that deep brain stimulation doesn't fix everything. You still see a little bit of that shuffling when he stood up, but then he's moving much more fluidly. So what are some of the reasons that we would proceed and talk about patients to potentially be candidates for deep brain stimulation? Some of the criteria that we look at are you having several hours of what we call off time? Essentially, that means when your Parkinson's medications, such as levodopa, aren't working very well, that you can't move very well, or that your tremor is more significant. Also, if you have what we call significant fluctuations, people that have kind of the roller coaster where their medications work for a couple of hours, sometimes a few minutes. It just depends on the person. Essentially, deep brain stimulation will sometimes kind of slow down those peaks and valleys, so that way you don't have as much of a valley when you're actually, after you've had deep brain stimulation. Also, those involuntary dyskinesia, kind of wiggly, twitchy movements that sometimes people have, especially as their levodopa medication's working really well, can also be improved with, and another reason why we might proceed with deep brain stimulation. So who are the people that don't qualify for deep brain stimulation? Although it can be a great treatment, it's not for everyone, unfortunately. So some people that have what we call Parkinsonism, or an atypical form of Parkinson's disease, some of those might include also conditions like progressive supranuclear palsy or multiple systems atrophy are really kind of the two, also what we call Parkinson's plus-like syndromes. Oftentimes those don't respond very well to levodopa or to other Parkinson's medications. And therefore, if people don't have as good of a response to levodopa, oftentimes they're also, deep brain stimulation may not have a significant benefit as someone who has a fantastic response to levodopa where they move much more fluidly and their tremor decreases. People that have dementia or what we would call significant cognitive impairment are also not usually good candidates. People that may be severely disabled, even when their medications are working or in the on state, may also not be good candidates. In addition, some people that may have certain medical conditions may make them not a good candidate for brain surgery. So what exactly happens after surgery? This is an example of one of our Parkinson's patients. About 2 weeks after you have the neurostimulator, what we call like the battery, implanted, either a nurse will usually, in this case Pat, if here in Buffalo, would initially turn the stimulator on, and then we kind of test all the different little contacts that are on the stimulation wires that Dr. Plunkett may have placed when he did the surgery. And we look to see which ones might cause side effects and which ones might actually cause benefits, like decreased stiffness of your arms or your legs, or decreased tremor. And after we kind of test out all the different contacts and see which ones seem to provide the most benefit, we send those individuals out on a specific setting. And then usually you come back a few weeks later and we'll kind of adjust things as needed. Oftentimes the first try, we don't get the best setting. You know, it's a trial and error. There's a lot of different ways and different weight combinations we can do to try to help someone be on the right, most beneficial path with the deep brain stimulation. So it takes time, and that's one thing we always like to remind patients is to try to be patient, because we do our best to try to improve your symptoms the most, but it often takes time. So what are some of the risks of deep brain stimulation surgery? Sometimes people actually can be a little bit worse after surgery. So sometimes they might have more freezing or stiffness, and their gait might actually get a little bit worse. There is a risk of bleeding in the brain or what we would call hemorrhage, which sometimes can lead to permanent disability or paralysis, and sometimes even death. Although it's very rare, it's still something that we have to counsel our patients. There's a risk in any surgery. A small percentage of people can also have worsening in their cognition or their thinking. And there's always risk of when we put metal in someone's body or a foreign object, such as a wire or that battery, there's always risk of infection. And as we all know, machines are great, but things still malfunction and sometimes they break. So sometimes we have to replace someone's lead or their battery. And over time, depending on the type of battery that we put in someone, we also need to replace that battery. If any of you have pacemakers, you might know that every couple of years you might need your pacemaker battery changed. So it's kind of the same idea. So some of the other more serious risks of deep brain stimulation surgery can be a very small risk of death. Sometimes people have seizures or convulsions that can be a risk whenever we put a piece of metal or electrode into someone's brain. You can irritate part of the brain that might put the person at an increased risk of seizures. There's also a very small risk that they've seen in clinical trials of a higher risk of suicide. So this is one from a more recent clinical trial showing the benefits of deep brain stimulation. You can see here that the darker bars represent deep brain stimulation and what we call best medical management therapy. So the best treatment with medications or physical therapy that we can provide a patient with Parkinson's disease. And you can see that the black bars, they have a much more significant benefit over time in things such as just quality of life, just different motor skills, how well they're moving, different complications. Oftentimes after deep brain stimulation, we can lower people's medication a little bit. That's not a reason to have deep brain stimulation, but often that is possible. As you can see in that very last column, that people did have a significant decrease in the amount of levodopa they took after they had deep brain stimulation. And this is just an example of the change in what we call on time. So the time when you're at your best, your levodopa or other Parkinson's medications are working at their best. That's 6 months after people had deep brain stimulation, on top of also having the deep brain stimulation activated, as well as the medications they were on for their Parkinson's disease. They have significantly more beneficial what we call on time, where they're moving at their best or their tremor is decreased, versus people that only continued without deep brain stimulation on the best medical therapy, so optimal levodopa or other Parkinson's medication treatment, had pretty much about the same on time without, as I have up here, troublesome dyskinesias, which are the wiggly kind of twitchy movements that you develop sometimes over time after being on levodopa. So I'd like to say, if you'd like to learn a little bit more about deep brain stimulation, you can attend the free University of Buffalo DBS seminar that's on May 23rd out in Orchard Park. You can RSVP to Pat Weigel. Chris can also pass along the information as needed, and I believe we have little flyers at the Medtronic booth. Okay, so I have a question. Why is ultrasound not talked about in our community? So right now, just as far as, I'm assuming that means is ultrasound beneficial in Parkinson's disease? Right now, there hasn't been any good clinical trials. There's been one clinical trial where Ultrasound's been beneficial for people with essential tremor, though it's not perfect. Also, ultrasound would provide, essentially it's like a permanent lesion versus meaning you kind of hurt that area of the brain, versus deep brain stimulation is something where we can turn off the stimulation so that you can kind of go back to close to your baseline. So again, if you want to attend, just RSVP and let Pat know, okay? Any other? Are we good? Yeah. Yeah, so if you have any other questions at the end, I know that's a big topic, and Pat goes into a little bit more details. Eventually, when I'm here at Buffalo, I'll hopefully also be helping her with some of these presentations and can answer some of your one-on-one questions once I've started here in Buffalo in July. Okay? Thank you very much for your patience.